everybody, we have 3 systems that all work together so that we all have good balance no matter what age you are. So we have our balance organ, which is our vestibular system in our inner ear. We have our leg strength. And then we also have our visual component, which we rely heavily on when something else is not working properly. So when we talk about balance, when it comes to the older population, we're talking like about 55 and older, things are a little bit more complicated because there's a lot of issues that can arise that can affect your balance. So the first thing I would have to say of common issues with balance is number 1, medication use. So if you're on multiple medications for any kind of heart problem, the biggest side effect is orthostatic hypotension, which is making someone lightheaded because we're trying to decrease your blood pressure, but when you move quickly or change position quickly enough, your blood pressure then decreases faster, you become lightheaded, and then you get up from bed in the morning and then you would have a fall. And that seems to be pretty common, especially older patients. We're talking like in their 70s and 80s. Most of their falls occur in the home. The second thing is regular musculoskeletal issues such as osteoarthritis, tendinitis, bursitis, any of those things that cause pain, whether you have surgery or not. Any kind of compromising effect on your muscle strength will affect your balance, because that is one of the 3 different areas that need to be working properly. If you just have osteoarthritis and you're having some, for instance, some knee pain or hip pain because of that, your muscles tend to get weaker, and so there's no stability for those joints, so you're at a bigger risk for losing your balance and then hence maybe possibly falling. Also, after an injury or surgery, such as a total knee replacement or a total hip replacement, automatically part of the healing process is active inflammation of the area, and then a lot of your muscles around the areas will kind of shut down. So when you don't have that strength, you will be trying to rely more heavily on the opposite leg, more on your back muscles, but it will cause you at an increased risk of having issues with balance because those muscles are not functioning properly like they should be. Diabetes is a pretty common condition, especially like type 2, which is adult onset diabetes. And what happens with a diabetic issue is that you start having something called peripheral neuropathy, and what happens is you start to lose that sensation in your feet. So when you're walking, especially outside, or you're not wearing proper shoe wear and you're walking your home even, you don't have that sensation there in the bottom of your feet to determine what is under your feet. So you might step on something, or you might not feel that there is an issue with the concrete outside, and you just more will likely stumble and lose your balance and possibly have a fall. Fall prevention for somebody in that group population, you want to really get to learn the side effects of your medications. Anything that has a side effect of orthostatic hypotension, or if it says may make you dizziness, the more of those medications that you're on, the increased risk you have for having balance issues. So try to be on top of it. And one of the biggest things is when you wake up in the morning, or if you're getting out of a chair, you just kind of want to take your time a little bit more. Loss of strength, like I said, leads to issues with balance, so you want to make sure that you're properly getting exercises that pertain to your injury and that you're strengthening the right things. Once the muscles are strong enough, your balance will then start to come back. And with those things, it's very important to know that, you know, the more issues you have, whether it's surgical or not surgical, there may be the need of an assisted device, and someone like a physical therapist would be the perfect person to be able to assess that for you and let you know, so that you can prevent falling in the home or outside the home. The other thing is with vision. As we age, a lot of people have visual difficulties, whether it's cataracts, glaucoma, and even macular degeneration. So because your eyes are a huge part of the balance system, when there's issues with the vision, you're going to rely more on your strength and more on your inner ear organ to compensate for balance. So if you're not taking care of your vision, then you're definitely going to have more issues, and that would probably come up more in the dark. So when you're at home and you have to go to the bathroom in the middle of the night and you have visual issues, it's really important that you have night lights in the home that kind of guide you to where the bathroom is or where the stairs are. So with physical therapy is a great option for patients that have issues with musculoskeletal injuries. Like I said, whether it's non-surgical or surgical, we're there to increase the strength in your legs, which then increases balance, but we also give balance exercises, which kind of challenges all the systems of your balance system and allows everything to kind of work properly again so that you can compensate if something is not working to its fullest potential. We can educate you on home modifications, so anything in your home that may come up as kind of like a red flag, so that we can tell you what to do in order to prevent a fall at home. So give us a call or click the link below if you would like some more information or an assessment of an injury, whether you're in the 55 and older population or a younger population and you're wanting to learn more about balance.